Welcome, and thanks for tuning in today. I am Linda Thompson, Dean of the College of Nursing and Health Sciences. For those of you who are in our audience, you can see and hear us, but we can't see or hear you. I want to start by saying that I hope you all are healthy and doing well. And to those of you who suffered from the virus itself or have a loved one that has been impacted, the thoughts of the entire campus community are with you. I want to thank our incredible graduates and students who are on the front line fighting this disease. I am so proud of all of you and grateful for the work that you are doing. Today, we'll be talking with some of UMass Boston's outstanding alumni, who will talk about their career and share their perspectives on the evolving situation and their experience with COVID-19. I thank each of you for being here today. We look forward to hearing from you. I want to share a little bit about what is going on at the University of Massachusetts, Boston, and in the College of Nursing and Health Science. In March, UMass Boston moved to a remote learning modality. We continue to operate in a hybrid fashion with the majority of courses in remote modality through the spring of 2021. About 2% of courses, some of which are in the College of Nursing and Health Sciences, are partially on campus. Students are receiving remote versions of the full range of our academic offerings, our services and our tools, which will enable them to complete their courses, receive credit, and continue on the path to their degree. University Health Services is offering COVID-19 testing to all faculty, staff, and students with required testing for certain groups. We continue to offer support services such as health, wellness, and counseling services, library services, advising and tutoring, and career services, just to name a few of the services we continue to offer. UMass Boston has offered discounts for various courses, has fundraised to provide more than 200 Chromebooks to students who didn't have personal computers, and continue to fundraise for the Boston Student Aid Fund to support our most in need students. 50% of UMass Boston's $12 million from the CARES Act will be used to provide emergency financial grants to students for expenses related to COVID-19. Prior to going remote, the College of Nursing and Health Sciences moved into a new space that better accommodates our growing college, especially the Center for Clinical Education and Research. The center houses the nursing lab, exercise and health sciences lab, simulation suites, examination rooms, and a computer lab. We look forward to the day when those incredible resources are fully operational, and we welcome you to come in to tour our space. I now will turn it over to our panelists. We will chat with each of them and then answer some questions that you've already submitted. So joining me today as part of our panelists is Shamsher, the public health nurse at Cambridge Public Health Department, Dr. Joanne Fergus. She's the director of the Division of Membership at the Massachusetts Nursing Association. Dr. Ann Gross, she's the Senior Vice President of Patient Care Services and Chief Nursing Officer at Dana-Farber Cancer Institute. Dr. Mary Jane O'Brien, she's school nurse, regional consultant for the Boston region, and founder of the Massachusetts School Nurse Research Network. And Handel Ulis, he is a student in the College of Nursing and Health Sciences and the Honors College, and he serves as a research intern at the Dana-Farber Cancer Institute. So let's start with Shamsher. He received his degree in nursing at UMass Boston in 2009 and currently works for Cambridge Public Health. Shamsher, can you share with us how you got interested in nursing and your path to the job you have today?
Of course, Dean Thompson, good afternoon to you, and thanks for this opportunity. Hello, hello panelists and then participants, good afternoon. As Dean Thompson said, I am a graduate of, proud graduate of, I should say, UMass Boston. I graduated in 2009. Started my journey at the UMass Boston in 2006. So I have a little bit of a background story how I got into the nursing program. So I would like to share that for you all to know that I was born and raised in Nepal, far western part of Nepal. If you all not are not familiar with Nepal, it's the tallest mountain in the world called Mount Everest. Just uh, kind of a point that will give you a little bit of idea. Any case, so during my last year of high school in my hometown, there are a couple of things kind of got me into go into community health route. The those contacts or these points of interest for me were maternal mortality ratio, and then the mortality rate for under 5 years of age for little children, as well as malnutrition. So I just wanted to give you the maternal mortality ratio or Nepal in late 1990s. There were about 900 deaths per 100,000. To compare that time in the United States, it was about 12 per 100,000. Just a data point. The good news here is that in 2016, that 900 deaths had come down to 239. However, in the United States, it has gone up a little bit. Again, it's nothing compared to Nepal. It's 19 per 100,000. For Nepal, though, the goal is 70 by 2030. Now, just wanted to give you an idea about the mortality rate for under 5 years of age. When when I was finishing up my high school, the under 5 years of age death rate was 140 per thousand live birth, and then if you compare that number with the United States, it was 12 uh, per thousand live birth. But now the good news is that has gone down to 7, just the kind of a touch points. Any case, the maternal mortality ratio, mortality rate under 5 years of age, and the malnutrition, these are the kind of a problems that interested me to go into the community health, public health settings work in Nepal. The now what changed brought the numbers down is we have been hearing a lot about the vaccination these days. That includes COVID vaccine. So the death rate for under 5 years of age in 1990s was mostly vaccine preventable diseases, and then I just wanted to happily share with you my hometown where I grew up. As of last year, it's 100% vaccination, rate. So those are things on a public health, community health settings that in long term help. And then that I continued my journey with community health, public health setting with UMass Boston, prepared me to go into basically any direction. I kept, my own old-fashioned lane that I continued to work in public health, which I started working in the Cambridge Public Health Department as a phlebotomist in 2005. I started my nursing school at UMass Boston in 2006, finished in 2009. Worked at med-surg nursing at Cambridge Hospital for 2 years, then continued on school health nursing. And now I'm fully with public health department as a public health nurse since 2013. So that's the kind of a little bit of background, a little bit of my community health, interest and then such. Thank you.
Sure, thanks. Can you talk a little bit about Cambridge Public Health's role in the pandemic and how, and can you tell us a little bit about contact tracing when there's a cluster or there's a confirmed case?
Of course, Dean Thompson. So just, I mean, the numbers are changing as all of us know. Unfortunately, they are on the wrong direction. So as of just I checked around at noon, we have, had 1,824 cases in Cambridge alone. That number probably will go up this evening as we update our information. Now, having said that, with that 1,824 positive cases, where population is roughly 117,000. I mean, it's a kind of a high, but not that high. However, with the contact tracing, with that almost 1,800 plus cases, that takes a lot of work behind the scene. So basically what happens on our end as a local board of health is that everybody in the state of Massachusetts, or including other states, when people get tested, by law, they're supposed to be reported to the state lab. This is called the ELR, Electronic Lab Reporting System. As soon as the ELR gets updated, then that will alert the MAVEN system. That's the system we use in Massachusetts, which is Massachusetts Virtual Epidemiologic Network. That network then will alert local board of health or people who use MAVEN system saying, okay, your town or city has a positive case. And then we go into our MAVEN workflow, and then we distribute among our colleagues, whoever needs, more cases following, and then whoever has a time to follow. That case, I must state that in Cambridge, about roughly 25% of cases we are sending out to this group called the CTC, which is Community Tracing Collaboratives, that is with the Partners in Health, that the state, the governor, Baker and Polito administration's initiation back in, I believe, April, that was initiated for contact tracing and monitoring. On our end, as I mentioned, roughly 25% of those cases are with the CTC for contact monitoring, contact tracing, and then follow up. However, we coordinate our efforts to make sure that we do not miss anything on the follow-up and contact tracing side of it. Now, going into clusters. So in Massachusetts, the clusters are defined, generally speaking, if there are 2 cases at one site, and then the index case, which is the original positive, may have exposed to 2 different household members. That's how it's defined, slightly twisted. However, in the school settings, congregate settings, daycares, that's different. We look at case by case. We discuss with the state, mostly epidemiologists on call. Sometimes, even though in the congregate settings, if there's only 1 positive case, with the collaboration with the state, we may end up saying that's a cluster, even though it doesn't meet the original criteria of the cluster. With the cluster, then again, we have to follow the context as we do with each cases to figure it out, where was the last exposure, and then what they need to do as far as isolation and quarantine.
Sure. So many of our students want to work in hospitals. What can you tell students who may instead be considering public health nursing as a profession? What would you say to them?
I think it's a great opportunity given, as we have been working with this COVID pandemic. I definitely encourage fellow nursing colleagues, nursing students to work in hospital settings, at least 2 to 4 years. Definitely broaden your horizon thought process, and there are more work in school health settings, public health settings. I know when my colleagues work in the emergency department, it has its own kind of a feel and then rush. However, public health is one of the area that includes, I have to say, school health too. You get to talk to a broader population, and then you can impact, bigger population, bigger, communities, bigger encatchment areas to make sure that, our focus that the prevention is better than cure, kind of, a saying that we can implement going forward. That includes a variety of things, vaccines, exercises, day-to-day health education, things of that nature. However, I know when we get used to the hospital settings, it's a difficult to kind of maneuver in these different areas. But as I said, happy to talk to my fellow nurse colleagues or nursing students anytime. If you have any questions, I think it's a really good area to look into going forward, that we can make bigger impact for the population.
Sure. Thank you so much, Shamsher. We are so proud of the work you're doing. Next, I want to let you hear from Dr. Joanne Fergus. Joanne received a master's degree in dispute resolution and her PhD in nursing from UMass Boston. She is currently the director of the Division of Membership at the Massachusetts Nursing Association. So Joanne, can you tell us briefly about what the Massachusetts Nursing Association does and what resources it offers for nurses?
The Mass Nurses Association, thank you, Dean, for the opportunity to be here on the panel, and it's an honor to be with the rest of the panel. The Mass Nurses Association is a professional association and a union of nurses and healthcare professionals. We're predominantly 90% nurses, but we also have other healthcare professionals, including physicians, social workers, in other unions. So the majority of what we do covers collective bargaining, and that's negotiating and advocating for the working conditions of our members. But as a professional association, a very large portion of what we do is geared towards continuing education of our members. So that's with scholarships for going on for degrees, that's continuing education. We have in-person and online CE programs free to all our members, and that's coupled with additional benefits that we have, phone discounts and travel discounts and other things. But our primary, the primary purpose of the association is around advocacy for practice and for patient care.
Sure. So in your organization, you have this unique ability to see what is happening across many hospitals and healthcare institutions. Can you tell us what trends you are seeing in the nursing workforce right now?
Right now in healthcare, we're seeing COVID and the pandemic exacerbate the exodus of our experienced nurses. So where the recession had held at bay the experience that we had in the hospital ready to leave, I think COVID has been an impetus for individuals who are already thinking about retirement to make that decision to leave. With that, we see an exodus of real institutional knowledge, but also clinical knowledge. And the concern is we don't have a mechanism for the pipeline of nurses coming behind. COVID and the pandemic and the necessary changes within the healthcare organizations, the acute care facilities, our home care facilities, have changed the clinical settings that we had in place for our pipeline nurses in school to get the clinical experience on the ground. And because of changes in the hospital, that pipeline has changed, and it's really hard for the nurses in school to get the clinical experience. So that is of concern, and that is watching this experience, especially around specialty areas, the maternity, OR, emergency rooms. And so that pipeline of replacement is we have to come up with some creative way to make sure that we're creating the experience necessary for our next generation of nurses to be in place and to be mentored before all of that experience and institutional knowledge leaves, and we don't have a great way to mentor them in the experience that they need.
You know, that's really important for us at College of Nursing and Health Sciences. That was music to my ears, your concern. You know, your master's degree is different than most nurses. It's in dispute resolution. And you now teach about that. Can you tell us about the importance of being trained in conflict resolution for the field of nursing? And maybe some examples of conflict and key takeaways you teach your students?
It is a unique, it's not a usual path for a nurse. It's a path that I ended up taking just because it was helpful for me to give name to the experience that I was having as a nurse myself in the profession. And I think even as I went through my master's program, the professors in that program would ask what conflicts we could possibly have in healthcare that would necessitate an interest. But we're in a profession that's fraught with conflict at every possible turn. We have the patients and the nurses, we have intergenerational conflicts, people coming into the profession from different stages and different eras and different learning styles. We have racial conflicts, we have ethnic conflicts, we have cultural conflicts. And so there's so many different stages and opportunities for conflict to take place within those institutions. And then we have the professional conflicts between nurses and physicians or other specialties within the institution. And so having a way to give name to that conflict and having a way to learn how to navigate and survive in that space was helpful for me, but then it was also helpful for me and important for me to be able to then pass that on to the students. And so a lot of what I do is transition programs for nursing students who are in their senior year. And so I get invited out to nursing programs to help shape and frame that for students so that they recognize what they're experiencing, but also give some key tools in order to provide a mechanism for navigating that in that space. And then for existing nurses to be able to have a way to de-escalate and then have productive interactions for the best outcomes for the patients and just the experience in the space.
Sure, that's great. You've done a lot of work with policy and legislation. Can you talk about how policy affects the profession and some of the work that you've done in this whole area of policy and legislation?
Sure. We have a whole division here at M&A with experts who deal with legislation and policy, and their job is to really pay attention to any policy changes that will affect nursing practice, healthcare provision, and the care that we can give to our patients. I think one of the things that I learned late in school, and so I came to it as my PhD as a focus, was really the impact of policy on our practice. And we don't really understand how steeped we are in policy as we practice. Policy makers affect everything we do, from the way our employers are reimbursed and are able to then provide additional care to the scope of our own practice. And often we have people with no experience in our practice and no experience on the ground making decisions in practice about how we provide care for our patients. And this COVID pandemic has actually exacerbated that. Being able to see that, when we see the disparities in care, some of that is steeped in policies and practices that are embedded in the systems of our healthcare. And so as nurses, as healthcare providers, we don't have the luxury of not paying attention to policies as they're being made. We have an obligation to be a voice for our patients and to sort of step out and advocate loudly as necessary to make sure that they have the things that they need. And that's in scope of practice. Right now, we're worried about PPE distribution. We're worried about appropriate staffing and entry into practice and the scopes of our advanced practitioners. All of those are key areas that are necessary for us to be paying attention to and giving voice to on behalf of our profession and the patients.
Oh, sure. So Joanne, you teach a health disparities class, and equal access to healthcare is a topic that you and so many of us are passionate about. Can you talk a bit about that and what you teach when you're teaching students about health disparities?
I think, again, the COVID has brought a large magnifier on issues of disparities that those of us who are in the profession of providing care have known about and have been trying to give voice to. I think it's shined a shiny lens on that for a lot more people. Part of what I try to do in reaching out to the students that I have the honor and privilege of engaging with, they're generally master's students in positions to impact policy. One of the things that I challenge my students is the same way we question our patients around compliance and their adherence to the things that we would want them to do for their best outcomes. I challenge them to interrogate the system in the same way, and find out why people can't be compliant, and to see their patients as more than just a diagnosis or the issue that they come in for, but to see them as a sum of all of the social determinants that affect their ability to be good partners in their care. So we have a system in place that we are, the greater metropolitan Boston is a minority majority city, but our hospitals and our institutions don't necessarily reflect the populations that we serve. And so if we are training healthcare providers, it behooves us as the individuals who have educators who have the ability to shape and sort of at least plant kernels of thought. It behooves us to encourage them to see past the norm of what we're socialized to know, and to think broader about what policies and what systems are in place that impact our patients' abilities to be good partners, and how we shape those systems so that they are better service to the community.
Sure. About 75% of nurses are white and about 90% are women. This doesn't reflect the diversity of the general population of our country. Can you talk a little bit about your thoughts on this and the importance of more people of color and males entering the profession? And do you have any advice for males and students of color who are considering this field or about to graduate?
It's a big question.
I know it is.
I would say it goes back to the prior question in terms of socialization. I think part of the work that's necessary, it's difficult for people to imagine something that they can't see. And in the systems that support our healthcare structures, our institutions of higher learning, the hospital structure itself, as you said, it's a predominantly white picture that's painted. And so even within that picture where we have diversity, where we have nurses of color and we have males, there's certain places that the system itself sees as acceptable locations for people to be. And so within that, telling the story, if you don't see somebody that looks like you, it's hard for you to imagine that that's a possibility for you. But even those who are steeped in it and the dominant group in it, if you can't imagine somebody that doesn't look like you sitting in a space next to you or being a leader next to you, then it's hard for you to sort of expand that scope. And I think that's the work with even with our institutions training the next generation of healthcare providers. There's a lack of diversity among our educators as well. And so there's a deep reservoir of socialized expectations of where people are and where people should be. And I think that is the work of helping our institutions and then our providers see something more, and to women of color, men coming into the profession, although I would say men in the profession disproportionately end up in leadership positions. And so even as a minority group in the profession, manage to move into dominance in that profession. But having said that, I would say to people of color coming into the profession, I would encourage them not to let somebody else write the story of what they should be or what they could be. The road on the journey through healthcare is fraught with barriers. I'm not going to lie about that. There are pitfalls all along the way, but there's some amazing mentors along the way too. And so there's work to be done to not allow a wall to be the final end of the journey. There's a way around that wall. I would also say to the individuals who are dominant within the field, who have managed to move through the field and gain positions of power, there's an onus on those individuals. There's an onus on individuals like me, but there is an onus on individuals, our white colleagues in those positions, to reach in and try to create a different story, use their leverage and their power in order to mentor and pull people through the barriers. And so one of the things that I was telling you earlier, Dr. Ann Gross was one of those people who would not let me give up. She kept finding ways around barriers for me and telling me you could do it. And so I think examples like that and examples of those of us who have, if we can be forward so that other people can see that we did, and we make a concerted effort to make it possible for others and create a different story and a different image, I think that's the work, and that's continuing work.
Sure. Thank you so much, Joanne. You just have so much passion, I can tell, and I just want to thank you for everything you're doing for nursing and for for our profession. Next, Dr. Ann Gross is the Senior Vice President of Patient Care Services and the Chief Nursing Officer at Dana-Farber Cancer Institute. She received her PhD from UMass Boston and is also a member of the College of Nursing and Health Sciences Advisory Board. And I want to thank her for all of the work she does on behalf of our college. And can you tell us what your job is as the Senior Vice President of Patient Care Services and Chief Nursing Officer? What does that really entail for people who may want to have that job sometime in the future?
Thank you, Linda, for the invitation to be here. It's great to be amongst old colleagues and new colleagues. So yes, it's my job. Sometimes I feel like my job is really the Chief Advocacy Officer, but really what I do, what it's supposed to be, is I oversee nursing practice and a number of other clinical services here at Dana-Farber that across our enterprise of inpatient, hospital, outpatient, our community practices and satellites. And then also in a leadership role like this, I participate with my peers in strategic planning and developing our priorities and policies for the organization. And that's where that advocacy can come in. And I think Joanne was just so correct in that, as we grow and assume leadership positions in the nursing profession, we have that opportunity to leverage our positions, and particularly our positions as nurses, because we are the most trusted profession time and again, as rated in our country. So I do spend a fair amount of time really trying to assure that our practice environments have everything that they need. Our nurses and other clinical staff are prepared to provide the highest quality care to our patients and their families. I also, in order to do that, take the opportunity, which is just an immense privilege, to collaborate with other partners externally. For example, UMass Boston, we have a long and very wonderful collaboration in many ways, in developing the next generation of nurses, in supporting the training and development of nurses and students in school. And so it's a varied role and a lot of fun most of the time.
So talk a little bit about what work has been like during the pandemic. What challenges have you faced, and what challenges are there specifically for people who have cancer?
Well, like everyone working on the front line to fight this pandemic, this has just been an incredibly challenging time, I'll say, both personally and professionally, for all of us. At Dana-Farber, when it became clear that COVID-19 was really moving into our community, we began to mobilize rapidly. And we knew that cancer was not going to stop for COVID-19, and so neither could we. We also knew that our patients with cancer are at greater risk for poor outcomes if they acquire the virus, because cancer patients who are in active treatment are largely a highly immunocompromised group. So overnight, practically, we moved 75% of our workforce off-site, and most of them are still off-site. We stood up an entire system of telehealth care, telehealth visits, and only have on our campus those patients and staff who need to be there to provide treatment or to receive treatment. We had to quickly develop all kinds of other operations to assure the safety of our patients and staff. One of those examples of our collaboration with UMass Boston is that when we saw that we were going to have to stand up all these new operations and we didn't have the staff to do that, we reached out to Linda and other faculty and ended up hiring several nursing students to come and staff our screening stations for staff and patients, so that they're every day before anyone enters our buildings, they're screened for symptoms of COVID. And we had wonderful support from students who took positions with us for several months. But I guess, as a clinician and leader, one of the most painful and frightening aspects of this pandemic has been the lack of a coordinated and effective leadership approach nationally. Unfortunately, our government has politicized this pandemic instead of bringing the country together. And it has been, it has resulted in a number of very challenging situations for all of us in healthcare. I think one of the starkest ones is what we all saw in the spring, where so many of our colleagues across the country, fortunately this was not our situation at Dana-Farber, but so many places couldn't even protect their healthcare workers with appropriate PPE. So, we now have a situation with that lack of leadership where the cases are still rising and soaring, actually, and the loss of American lives is just staggering and continuing to climb rapidly. But there are some very hopeful signs on the horizon, and we are very involved in now and looking to, developing ways to distribute the vaccines that both Pfizer and Moderna are putting forward with such amazing efficacy. These are going to be very important tools to restoring the health of our nation. And certainly at Dana-Farber, our patients will be among the first to receive this vaccine.
Sure. So if we've recently elected a new president, how do you see things changing in healthcare nationwide under new leadership?
Well, I think what I hope, that we will see is a focus in the new administration on the health of all American people. The people of our country have overwhelmingly elected a new president and new vice president, and I think they understand their roles as leaders for all Americans, not just those who voted for them. So I feel optimistic, and as I see them assembling a team of scientists, clinicians, and other experts, especially in the area of healthcare disparities, because all of these different perspectives are going to be critical in helping lead us out of the pandemic. I think this group that they're assembling, and when they get a nurse on the team, I'll be really thrilled. But I believe they will. But I think they understand the need around developing policy and assembling and distributing resources across the entire country where they're needed. And that, we've seen this play out over the last 9 months, how that just didn't happen. So I think this comprehensive plan to eliminate the ravage of COVID-19 will also set us well for healthcare as we move beyond the pandemic. We certainly must continue to provide healthcare for all. And I think hope the new administration will continue efforts to improve that access over time. Obviously, vaccine distribution and some probably other nationwide mandates in the short term will be necessary to do that. But I think the coordination and the rebuilding of an infrastructure are top of their minds, and so I feel optimistic.
Mhm. And I know you and our other panelists are very passionate about equal access to healthcare and addressing healthcare disparities. Can you talk a little bit about your thoughts on that?
Sure. As others have said, this pandemic certainly has demonstrated even further and painted a starker picture of the health disparities and inequities in access to care in our country. You know, we have all the data we need to show how much more negatively people of color, people of lower socioeconomic status have fared through the pandemic. And you know, I think we have to continue our efforts to assure access to healthcare for all people in our country. Now more than ever before, I think we have to address with even more rigor the social determinants of health and the inequities that exist across our country. I think that's been neglected a lot over the last 4 years. And I think I actually think our profession, our nursing profession, is very uniquely positioned to make an impact here.
Mhm.
There's so many, as you see on this panel today, there's so many directions that a nurse can take to practice, and in that arena of health promotion and disease prevention, and at the community level, it's just an amazing opportunity for nurses. And I think, as been said, we also have to really work hard to prepare thoughtfully the next generation of nurses that will reflect the populations that we have in our country. You know, the demographic of America is really changing. And I love this panel. This panel looks a lot more like what we need across all of nursing, because we need more men, we need more people of color, we need people of diverse ethnic and cultural backgrounds to really reach out to all of our communities equally across the country. So I think that the programs like we have between Dana-Farber and UMass Boston to provide an entry level of residency program of developing nurses from diverse backgrounds who are interested in a career in oncology. We need more of that. I'm really proud of that program. I know you are too. And I just want to like quadruple it across other specialties everywhere. But anyway, so I just think that there's a tremendous opportunity in this area for nurses to make a difference.
But if you're going to give some advice to our students who are graduating this year, what would you say to them?
Well, this is such a unique time in our history, in our healthcare history, in our country's history. And I think as nurses coming into the profession, you know, it's in some ways a very devastating and painful time, but in other ways it's a time of real opportunity, because you are the future of nursing. You are the future of our profession. You are the future of the health of our nation. And I think what we're all seeing is that we have to build a stronger infrastructure. No matter who would have been in the administration, we didn't have the infrastructure in our public health across our country to deal with this pandemic. And so I think taking a look at where we are, there's so much good in this country. There's so much possibility. I think for a nurse coming into the profession, it's sort of that analogy, the world is your oyster. You can really have an impact. And I think it's been said, I think others have been talking about this idea of, get mentors, get people, that have really worked for years and developed careers, and get all kinds of mentors to help you in your path. I have learned more from people who go a few steps or yards or years ahead of me than anything else. And I really think that's important.
Thank you so much, Anne, and thank you for all of the support you provide to the students in our college.
It's a pleasure.
Sure. So Dr. Mary Jane O'Brien received her PhD at UMass Boston's College of Nursing and Health Sciences, and is the school nurse regional consultant for the Boston region. And she is the founder of the Massachusetts School Nurse Research Network. So Mary Jane, school nursing is such an important field, and we are so proud of the work that our alumni like you are doing in this profession. Can you start by telling us a little bit about your background and how you got into this line of work, and really, what do you do?
Thank you. Thank you so much, Dean Thompson. It's a pleasure to be here. I'm delighted. I'm honored to be a part of this panel, and it's great to see everyone. So I began my career, let's see, back in the 70s, and in a hospital, because even though when I was in undergraduate program, I really loved community health, but in those days, and I think it holds true today, I felt like I needed that experience in the hospital. So I began my career in a Boston teaching hospital as a pediatric staff nurse on an oncology floor. And in the 70s, the outcomes were not what they are today. So it was very challenging. I ended up spending 13 years at that hospital, and my last few years were spent in the emergency department, where I saw a lot of preventable trauma. And it just resonated with me that if there was better health education, that maybe so much could be avoided, so much pain, so much suffering. So decided to take the leap into school nursing, and did that. And as in fact, my manager at the time said to me, "I'm not going to post your position right away. I'm going to pretend you're on vacation because you'll be back." So that did not happen. Unfortunately, after my first year and being very captivated by being a school nurse, the Boston Public Schools decided to cut school nursing in a money-saving fashion. And they did this in our last paycheck in June. We all got pink slips. So fast forward to September, and the parents came in with the vials of insulin and other medications for the school nurse, and there was no school nurse. The plan was that the local public health nurse would pop into the schools and deliver school care. What a teachable moment we let pass, because the parents were very vocal at the time. It took 3 years for Boston public school nurses to be totally rehired. And during that time, I worked as a substitute because, as I said, I had been really captured by and humbled by the amount of need the school nurse fulfilled. It was eye-opening to me at the time. So school nurses provide, it's very difficult to explain what school nurses do. But if you could think of it as 3 domains, the first domain being education, the second domain being traditional care, traditional health care, where we do chronic disease management and provide direct service care. And then the third prong being public health. So we do disease surveillance and immunization compliance and things like that. So I have often said what makes school nursing a specialty is the way that school nurses translate the nursing care provided in hospitals out into the community and out into the school. We meet students and accept students where they are. And we provide those services that they need in order to access curriculum. Right now, what I do, well, what I do is I'm the regional consultant for the Boston region. The state of Massachusetts is divided into 6 parts by the Executive Office of Health and Human Services. And so there are 6 regions. I am the Boston region, which is Region 6. I am the Boston Region School Nurse Consultant, and as such, I advise districts on what their health services departments should look like. I promote best practices, provide professional development, and make sure that the health services are equitably positioned to reach all students so that they will have access to those health services. I think that a lot of misunderstanding about what school health is the fact that we have lots in the Boston region, lots of students who have immigrated to this country. We may be their first point of contact into the healthcare system. Students are accepted in Boston public schools, even though there are mandates that students have certain immunizations. Students are accepted without those. And so then the school nurse has to work with getting immunizations, getting that student a primary care provider. So there's lots to it. And it's
Sure. So can you talk a little bit about the history of school nursing, changes over the years and the importance of school nurses to what happens in schools and what happens to children and what happens to children living in the community?
certainly.
Mhm.
So the history of school nursing goes back to 1905 when the first school nurse was hired. It was a model that had been shown to be successful in New York City, and so communicable disease was rampant in the early 1900s. Students would be excluded from school, so absenteeism was sky high. So the students would be excluded, but there would be no follow-up. The school nurse was hired to provide that follow-up. And if we look at it now, we would call it care coordination. So someone to translate what needed to happen to get that student healthy and back in school. So the earliest school nurse was Annie McKay in Boston, and she holds a place of reverence in the hearts of most school nurses because she really set a model of not only disease surveillance and really making sure that she recorded a lot of data, but also she did things like not only screened for vision and knew who needed glasses, but went out and found funding, went out and found organizations that would fund buying glasses for a student, much as school nurses do today. So that public health, that care coordination, and disease prevention, wellness, and making sure that students were, and the motto is still today, healthy in school and ready to learn.
Mhm. Yeah. This pandemic has really made a difference in terms of the function of school nurses and how they've adapted. What was the day like for you and your colleagues before COVID, and how has it changed now under COVID-19?
About 10 to 20% of students in the Boston region have special healthcare needs. So the school nurses are busy. There's lots of care coordination that goes on. In the 1970s, the hospital schools, which is a phenomenon that most people don't remember, but the hospital schools are where students were taught, students who had special healthcare needs. And in the 70s, those hospital schools closed and those students were mainstreamed. And federal law protects the rights of all students to a free and appropriate public education. So school nurses are that conduit that allows students who have special healthcare needs to access the curriculum. So we're busy like everyone else, and we do disease surveillance and lots of wellness and prevention. COVID-19, a complete and total pivot. the first thing that school nurses did was to donate their PPE. Schools closed, and especially in Boston, the emergency medical services needed PPE, and we just donated all our PPE, all our thermometers to them. The second thing that happened was nurses started working for their local boards of health. They started contact tracing. They learned the MAVEN system. They trained in that MAVEN system, which is the I'll get it wrong, Massachusetts Virtual Epidemiologic Network. I think I got it. And so they trained in that. They became contact tracers. They volunteered with Partners in Health. They went to work for them, or on a part-time basis. So we had lots of nurses, and across the Boston region, the nurses in Brookline and Revere, Chelsea. There were some areas that are really high hit. Revere, Winthrop, all parts of the Boston region, as well as Boston. So they just pivoted and started working, really dug their heels into to the public health efforts. In addition, they set up virtual offices. First of all, to check on their students who have special health care needs. So they felt it was really important to check in with those students with diabetes and other chronic illness. And so they set up virtual offices that were really creative. And then they recognized that it wasn't just those students who needed to see them. I mean, school nurses are available and accessible to all students 6 to 8 hours a day. So the virtual offices really took off, and school nurses, like all nurses, were busier than ever, and still are.
Sure. You founded the Massachusetts School Nurse Research Network. Can you tell us briefly why you started it and what the organization is, what does it do?
Well, I was one of the people who founded that back in 2004. There were about 10 of us who got together and said, look, we need to make known what it is that school nurses are doing. We need to let people know the positive outcomes and the positive effects that school nursing has, not just on the students, but, and I think that so much has come out during this time. So much has been written about the importance of school health and school nurses. But in 2004, when we founded this, it was really about getting on the map and knowing that research was the way that we had to do that. So we did some studies, and we are published in several of the school health journals, but really JAMA and Health Affairs have published articles about school health, and they call it the hidden source of healthcare. Hidden because we haven't really promoted ourselves very well at all. And like so many other nurses, we're busy doing, and you know, we really need to reflect and write and promote what it is that we're doing. So that is the reason why we founded it. But and as I said, we have published some studies. One of the key things that I was involved in, and I'm very proud of, is we became a 501c3 nonprofit in 2017. And right now we're working on a qualitative study around exactly what school nurses are doing during this time. And I will keep you posted as to how it turns out.
Thank you so much, Mary Jane. As someone who started out her career like I did as a school nurse, I really appreciate the work that you're doing. And, you know, the university faculty would be happy to help you with some of your research. So I'm just saying that on behalf of them. So our last guest is one of our superstar students, Handel Useless. He is one of our students in the College of Nursing and Health Sciences, and is also a student of the Honors College. He even though he's doing all of that, he is also a research assistant intern at the Dana-Farber Cancer Institute. So boy, I know you are really busy. Handel, as we've heard from some of our panelists, and as you've been seeing firsthand what's happening in the industry, it is important for nurses to better represent the demographics of our country, and our profession is going to be so better off when you are a nurse. Can you tell everyone why you made a decision to go into nursing?
Good afternoon, everyone. Thank you, Dean Thompson, for giving me the honor to, be a part of this panel amongst exceptional scientific leaders and a wonderful audience. That's a very loaded and important question. And I have many reasons as to why I chose to go into nursing. Some of them being the earthquake in Haiti, which led to the death toll of over 30 family members and close relatives in 2010. The event was traumatic for me because I was only 10 years old and lost a lot of people I cared about, including my grandmother, whose face and body was completely lacerated, my pregnant aunt, and a lot of my younger cousins who either died on impact from being crushed by the buildings or later with infections that had already compromised their organs. So I began to look at some of the reasons as to why so many Haitians suffered and died from the quake, and quickly learned that it was due to a lack of hospital beds to treat the wounded, unsanitary treating conditions as they resorted to taking care of patients on the streets, and just an overall poor healthcare infrastructure. So it led me to want to find a solution. Still to this day, it's one of the primary reasons as to why I want to be a nurse. As a child, I also remember having an innate willingness to help others. I remember in kindergarten rushing to get the first aid kit when my professor got a bleeding paper cut in class, getting out the gauze and Band-Aid and aiding her to place her finger over running water. So nursing has always been an innate part of me, whether or not I wanted to realize it. Music therapy has also been really helpful. I've been playing the violin for over 13 years now, so I didn't really appreciate it until I started grieving from the earthquake. And I started using it as a therapeutic agent to not only heal myself, but others, which led me to volunteer to play for upset patients at the hospital, at graduations, or at birthday parties. Um, I think everyone deserves a fair shot, and I can definitely relate to that need because going into college, my parents were not certain we would be able to afford my education if it wasn't for financial aid at UMass Boston. I'll also add that moving from Haiti at the age of 4 wasn't also easy, as my parents and I were initially homeless and had to live in a New York basement for months before moving to Massachusetts. Another definite reason is due to my desire to change public policies, help low-income families on a practitioner and PhD level, and lastly, to create a clinic specific to their healthcare needs. Now, I'm only 21 years old, and my knowledge may currently be limited, but I'm a strong believer in policymaking because it's these exact policies that influence the health outcomes and lives of general people residing in the US. Joanne mentioned this earlier, but just to echo her words, it's a very powerful tool to changing social determinants to health and equalizing fair access to healthcare. So that's a little bit about my background and why I wanted to go into nursing.
Sure. Yeah, I just, every time I hear that story, it just gives me goose pimples. Can you tell us about what your classes are like now and how it's different from before the pandemic?
Yeah, definitely. There have been a lot of class changes due to COVID. I can definitely talk about the challenges too. One of them is not having the proper study space or environment to prepare for exams. Exams also seem to have gotten a bit tougher because considering everyone's at home and also has extra responsibilities that take away from study time, it makes it a bit more difficult to adapt. Some of the other changes are the shortened clinical hours, as is expected due to COVID surges, and not being able to see all the equipment that's always been another difficult component because we were more frequently able to see and physically hold the equipment we were learning in our clinical courses before the pandemic. And to me, that's a vital component to improving nursing skills. So we felt more prepared for the exams and competency testings. So now a lot of my colleagues and I are learning that the virtual experience it requires extreme adjustment to our studying habits. And I guess you could say closer visualization of the information that we're learning. And I can definitely also talk about how the classes felt more flexible before the pandemic because I had stable employment. I was able to see and play the violin for patients at the hospital. My parents used to work more hours. As a result, their paychecks getting cut consequently led to malfunctioning of our internet connection, sometimes food shortages, because our household size is 6 people. So it's been a lot, but I think one thing that's important about the UMass Boston community is that we're resilient and we pick up from our struggles.
Boy, that's quite a bit. How do you and your fellow students feel about the pandemic? And does all of this reaffirm your desire to be a nurse? Do you think this may scare off people to want to go into this profession?
My fellow students and I have a range variety of feelings about the pandemic. One of the prominent things we're aware is the genetic risk to COVID. As studies have been showing that people of color are 3 times more likely to get it than white people. So it's definitely a mental and emotional battle, especially with the division that's ever so present in our country. But I have to say, students and professors adapted to the pandemic phenomenally, considering what was at stake. And professors care a lot about our mental health. I have amazing ones that check up on us and our stress levels before class. So that helps with relaxing the anxiety that comes with trying to learn so much content online, let alone staring at the screen for so many hours. I definitely think it reaffirms my desire to be a nurse, and I do not think it scares people off because UMass Boston professors, specifically in the nursing department, are one of the most encouraging, endearing, and challenging professors I've ever met. I think this pandemic has also empowered students to be more involved in discussions like this and other important meetings that require reflection, because the ultimate goal is to teach and learn from each other to better the society and healthcare facilities we're working in.
So Handel, you probably are one of the most involved students that I've ever met. Tell everyone about everything you're doing outside the classroom with clinical jobs and then all of the extracurricular activities you're involved with.
Thank you. Yeah, I can't take the credit for myself. UMass Boston has outstanding resources outside of the class. I have many quality mentors that I look up to, some students, some staff. In regards to my organizations, I'm part of the Vice Chancellor's Advisory Board, and I'm a Police Community Advisory Board Executive Officer, which both partly function to strengthen the interpersonal student to staff relationships at the university. I'm also a co-coordinator for the UMass Boston First Diversity Council, called SEAT, the Student Equity and Access Team, which seeks to provide climate work and students a chance to voice their concerns to the Assistant Chancellor. Additionally, I'm part of the Honors College, Alpha Lambda Delta, Golden Key International Honor Society, and the McNair Scholars Postbac Program. And they're all involved in directing me to get my PhD in nursing. Lastly, I'm the class representative for my cohort, a babysitter, a barber, when I'm either cutting my own or my siblings' hair. And as mentioned earlier, a music therapist at Melrose Wakefield Hospital, and a Dana-Farber cancer research assistant intern.
Boy, I get tired listening to all of the things you're doing, but I'm just so proud of you, you know that. And I just can't wait to see what you're going to be doing 10 years from today. So, I'd like to just turn over, some questions that our audience has provided that they submitted in advance. So I want to just turn the questions over to the panel. Could you each share a high point or a story or a moment that made you proud of your practice, proud of your profession over the last several months during this pandemic? So I'll start with you, Joanne.
There's just been so many, so many, just nurses and providers leaning in at the scary moment when the instinct is to sort of hunker down. People are rushing out to find ways to be of service. And even if they're being furloughed, they're, as MJ is saying, reaching out and trying to figure out how they can use their skills best and sharing the resources of what they have. And so that really makes me proud of our profession, that instinct to run in and lean in and be of service. And so I've been really proud of how our profession has just risen to the challenge.
Mm-hmm. Thank you so much, Shamsher.
Sure, thank you. My low point was when I think it was in May that I could not buy enough milk for one of family I was trying to deliver some milk. It was rationing, and then that reminded of back home. However, I was able to buy 2 gallons, and when I delivered to this family, that they could not go outside because of all of them were isolation because of COVID. That was a high point on public health all around. So.
Thank you so much. Mary Jane, could you share a high point or a moment when you were the most proud?
There was a epidemiologist that I work with. We have a program in Boston Public Schools that we surround students with care, students with diabetes. And so the epidemiologist actually called me to let me know that one of her patients was admitted for ketoacidosis. And anyway, she was came to the ED with her aunt, and so on discharge, the epidemiologist called the school nurse because had met the school nurse on many occasions when she brought the student in for appointments and with the mother. So the epidemiologist said when the school nurse called the family, the school nurse found out that mom and dad both had COVID. Dad was in the hospital. The aunt had taken the child to the hospital. This is a non-English speaking family. And so when the school nurse found out that the student was discharged, she met her at her home, outside her home, and found out what they needed. And as Sham said, groceries, brought them to the house, went over the insulin doses with the aunt, tried to reinforce the teaching that she had done before with the student. Student didn't have her Chromebook that was free from school. So she went to school, picked up the Chromebook, picked up the hotspot, came back to the house, sat on the stoop, set everything up for the student, and then set up virtual appointments, follow-up appointments with the endocrinologist, and a follow-up appointment with the primary care provider. And while the endocrinologist is telling me this story, she said to me, "It's just amazing. It's just amazing." And I said to her, "Yeah, that's what school nurses do, right? Education, traditional healthcare in terms of care coordination, and public health. Let's get the groceries," because she also hooked them up with the school, which was a food bank.
Sure, that's amazing. And could you share a high point? Top that.
This is hard. There's so many. I think in an overarching way, I think the way Joanne started this out, I have a colleague in New York who has been quoted actually in the media as saying, nurses didn't run away from this pandemic, nurses ran toward this pandemic. And I have to say, on every level, my immediate team worked for months, 7 days a week, round the clock, trying to do all they could to make sure that our nurses at the bedside had what they needed. And then our nurses at the bedside every day. I mean, there is no one moment. Every single day they show up. And, you know, we, like everyone, have instituted a no visitor policy. So not only are they treating patients as they always have, but they are the family. They are the chaplain. They are the nutritionist. I mean, for a long time, that they were doing everything because we had so few people on site. I'll just say one little story to paint a little, fuller picture. Our Dana-Farber hospital is located inside the Brigham and Women's Hospital. And, as we've said, oncology patients are more susceptible to poor outcomes in COVID. And one of the units of our oncology hospital were the first staff to open up the first COVID unit inside the Brigham. And they went on a moment's notice and opened up that unit and continued to care for patients with COVID. They wrote narratives about their experience. They had countless moments where they were the last person in the room holding a patient's hand as they died, because so many people did die early on. And so it's a collective. I every day, no matter how tired I am, and I'm tired some days, I just know that, there are so many people. I'm surrounded by amazing nurses, nurse leaders, clinicians who, as my colleague in New York says, have continued to run toward this pandemic and really run toward their patients rather than run away from them.
Sure. So, Handel, could you share a moment that you have felt most proud of being a nursing student?
Yeah, to echo what the others are saying, I think it's tough just to think about one specific memorable moment, just because I feel like there's a lot of high points with being in nursing school, especially over the past several months. Some of them just feel like passing, with so much stresses on our plate. But I can definitely speak on a high point that, in particularly, that occurred before the pandemic. This was when I was in high school. I think 2017. I was pulled aside by my guidance counselor, and he gave me a letter, and it was from the White House, and it said the Presidential Volunteer Service Award. And I asked him, well, what is this for? And he's like, well, you have over 500 community service hours. And for a moment, it struck me because I knew I was doing so much work, but I didn't really keep track of how many hours. I would just send them in. And to me, it was important because it was a proud moment in the sense that I knew that a lot of people were being impacted positively. And what's nice about it is that I was able to do this at such a young age. So it kind of motivated me and inspired me to want to continue doing that. And, it ultimately resorted to leading me to apply for nursing, leading me to join my first internship with Dana-Farber, let alone first internship in general. So it was a lot of new experiences, new opportunities, and definitely multiple high points. So yeah.
Yeah, thank you. So you've been volunteering and doing things above and beyond your schoolwork for a long time. That is why you're such a special student. Could you talk a little bit about what advice you would be giving to our students who are graduating this year? So what advice would you give them, Joanne?
Be persistent. These are challenging times, but these are exactly the right times that we need new eyes and new hands and new passion and new energy. And so for the new students that are coming in, it's hard because of the challenges around clinicals and all of the other constraints around COVID and the scariness about COVID. But this is a real opportunity for them to write new stories, and the next chapter of nursing is in their hands. And so we're never going to go back to what we were. And in a lot of ways, I say thank God for that, because we needed to change a lot of what we did anyway. So these are new opportunities to think differently. But this is their time and this is their moment, and they need to challenge us to tell us what we need to do for them in order to pave the way for them to be able to be the next generation of nurses that we need.
Sure. Shamsher.
Of course, echoing Joanne's point, be persistent, be in touch. For example, I have, classmates from all over the world, to name some, Tanzania, Kenya, just, to mention some. So be in touch. If you don't have anything to do, just say hello. That helps a lot. And then, just don't have just 2 words. Be a little bit of detail what needs to happen. We are getting used to this SMS, the text messages, but in nursing world, we need a little bit of details to carry on our work.
Great. Mary Jane.
Well, I can't really top those. I would say that you're needed, and we will do anything we can to support you. Right now is challenging. We all know it, but we are here and we will mentor you and we will support you. So come on, you got this.
Great, thanks so much. Anne.
Yeah, I was going to say, you know, we all stand on the shoulders of those who have gone before us. So I think mentor, get mentors, have more than one, and use them. You know, I think as Shamsher said too, that networking and staying in touch with people will carry you forward in your career.
Mm-hmm. Handel, what advice do you provide to these nurses about what you need in order to be to feel successful?
Yeah, that's a really good question. In regards to what I think I need to be feeling successful is, you know, reach out to the youth. If you've already graduated, try to get them involved in whether it's a discussion, meetings, advisory boards, get them involved, because I think one of the most important tools that I've seen our younger generation use is their voice and their desire for change. And a lot of students have a lot of ideas, such as myself, and a lot of them are willing to be the change that they want to see. So I think one of the most important things I would tell nurses is to, similarly how they, you know, provide patient advocacy, provide student advocacy as well, you know. And that's really my best take on it.
Thank you so much, Handel. I just have one final question, and I just like for each one of you to just talk a little bit about what are the most important traits or skills that I think nurses are going to need as we move forward in time. So I'll start, Joanne, what are your thoughts on that? Important traits and skills.
Compassion, empathy, and persistence, using the voice, as Handel said, just being the advocates and the charge that we are meant to be, and using our resources in a way that was there for us. So just as I said, for Anne and for Mary Jane, who dragged me through, be that for other people.
Yeah, having people to drag you along is so important for success. Shamsher, what are your thoughts?
So somehow Joanne gets the good, good points before me. So thanks, Joanne. So basically, I think we need to be persistent, and then we need to tell each other. We talk about health equity, but we don't practice. So I can give you an example. When I was at UMass Boston, there were student, friends. They would just buy 2 vitamin water bottles. It costed in 2000. I still remember $2.35. That gives you about what, $4.70. We could have eaten nice, fruit salad and whatnot. So we need to teach people what are the practices we need to, what we preach, we practice. So these are things we forget. Health equity is a big topic. I think we may have to go back to that at some point when we have more time. So.
Well, I'll have to remember that and bring you back to talk more about that. Mary Jane.
I'm still laughing from that, sorry. Great point. I would say be patient, have patience. I noticed that so many of my younger colleagues are so quick with technology, and sometimes it is patience and persistence that pays off. So if I were to give advice, that's one in it, what everyone else has said, but that's one thing I would say.
Okay, Anne.
So 2 things come to mind along with what everybody said. I just want to make one thing clear. We dragged each other around. I got dragged forward too. I needed all that support, and that kind of mutual caring and support, I think, goes a long way through anything, especially a PhD program. But I guess to me, there are 2 things that come to mind. So I think first and foremost, when I think about students coming into the workforce right now, it's such a, as we've been talking about, such a stressful, challenging time. I think I would encourage people to figure out what is it that sustains you, that keeps you resilient. and make sure you are making that happen in your life, whatever it is. And there's no one answer to that, but figure it out, because you need to take care of yourself in this kind of time. The other thing that came to my mind just immediately was courage. I think nurses coming out of school today are facing some very huge issues: racism, inequities in health disparities, you know, COVID still. And often the voice of patients gets lost in the mix. And nurses have I don't think we always use the platform that we have as the most trusted profession, as the profession who is really on the front line, whatever that front line is, whether it's in the classroom or in the hospital or in the community. And nurses know what's going on. And often nurses don't always have the courage to speak up in interdisciplinary environments. And so I think that is going to be a critical skill going forward. I agree with Mary Jane that we need this patience with the process, but we also need an impatience with change. We need to make change in this country, in our healthcare system, and the energy and passion that nurses coming out of school now have will be that catalyst.
Mhm.
So,
Any last final words you want to share, Handel?
Yeah, I really like what Anne just said. I think she said something along the lines of finding a reason or a passion, as to why you want to do what you continue doing. And I can off the bat think of something, and I'll share a brief story. I remember younger, I mentioned my grandmother before the earthquake, how she was a really good friend for me. And I think one of the things she always used to mention is, when I die, play the violin at my funeral. But I was in the US when she passed away, so I wasn't able to play the violin for her. So I kind of took that as a driving point to, as I mentioned, playing violin for patients at the hospital. And I think it also helped nurses in a sense, because they're stressed out, they're on floors with a lot of patients. And, sometimes just hearing soothing music can relax them. So I think that for me was one of the things that, as Anne mentioned, finding your silver lining as to what's continuing to propel you in your direction. And that's one thing I want to say. So thank you again for giving me the opportunity to speak on this panel.
Oh God, yes, it was such a pleasure listening to each and every one of you. I am just so happy that you took the time out of your busy day to join us as part of this chat. And I'm just so encouraged by the future and looking at Handel, and then by the people from our university who make me so proud. So thank you all. And I really enjoyed you being a part of this with you today. So I hope the rest of your day is just as good, and keep doing God's work, because that's what you're doing. Bye now.
thank you, Linda.
Thank you.
Thanks.
So much.
Thank you, everybody.
All right. Bye-bye now.
Very much.
Mhm.